Dental implants. You might ask yourself, am I a candidate for a dental implant? A lot of that has to do with your bone quality, how long a tooth has been missing. Those are things that we can absolutely discuss in your next appointment when you come in, but a dental implant is really great at maintaining bone levels. If you have a tooth that's missing for a long period of time, it's one of those old adages, if you don't use it, you do lose it. You lose the bone. So the bone can get skinnier in that area. So it's super important that we want to maintain our oral health and our function by placing dental implants. Another great thing about implants is that they function just like teeth. You don't even notice the difference, or should you? That you can floss individually between them if that's the type of implant you got, and you don't have to worry about removing it. It stays with you, and we'll make sure that when you keep coming in for your routine hygiene exams, that we can maintain the quality of the implant for a long time to make sure that there's no failures down the road. Can implants fail? Unfortunately, anything can fail. Clearly, your tooth itself had failed. So yes, implants can fail, but it's very rare. We've been super lucky that in this day and age, our implant placement has become a lot more predictable with the use of technology. We're aware of a lot more going into a surgery, which makes them a really, really great option. And as long as you do your part and I do my part, we have a great success rate. Smoking is probably the worst thing that you could do for a dental implant. When you smoke, it reduces the amount of blood circulation that you have in the area. And the only way an implant fully integrates is by having a lot of blood that can bring bone cells into the area so that the bone can attach to the titanium and fully integrate into the mouth. So smoking is a big no-no. Another thing that you can do to help avoid an implant from failing is loading it too early. So what do I mean by loading it too early? It's super important to make sure that after an implant is placed, that it's not in use. You don't want to function on that implant right away. It's very easy to want to function right away because, oh, finally got like a little post in there, but you don't have the full crown of the tooth. Here is a dental implant, okay? So we're gonna take off the crown of it and we're gonna unscrew the little abutment that goes into it. So there's always 3 pieces to an implant. The day of surgery, you'll only get this piece, okay? This piece is the implant itself, and so that's what I've been referring to it. I'll put a little cap on it so that it will heal, but I don't want you to use this to function. So do your best to just stay away from that. Obviously, food's gonna come into the area if it's only a single tooth that's missing. But we're not going to try to function on this little short tooth until we get the final crown on it. Then after it's fully integrated, I'm gonna see you again. It could be 4 to 6 months from when I place it, and we're gonna put a little post on it and take an impression. And we'll take it with our digital scanner, which is great. And then in a week or so after, you'll be able to come back and you'll get your crown. So it is a long process. I know it's kind of frustrating, but we can't rush biology. It's important that an implant fully integrates because we are spending the money and we want to make sure that it's worth the investment.